ladies and gentlemen, thank you so much for coming. First, I'd like to introduce a few special guests. Irene Mark from the Alberta Senior Citizen Housing Association, as well as Douglas Mills. As well, Tammy Leach and Dr. Patel of the Alberta Continuing Care Association are present. First, Premier Prentice will speak, followed by Minister Johnson. And then please hold your questions until the end. Thank you.
Well, thank you, ladies and gentlemen, and welcome. I'd like to thank everyone for joining us. Special thanks, though, as I begin, to the Wenke Foundation for welcoming us to this incredible new facility. I remember when this was a dream that we talked about, and so to everyone who's here from Wenke, let me just be the first. This is not the official opening, I know that, but let me be the first to say thank you and congratulations for the incredible work that you've done. And he is a great Canadian for all of the work that he has done. I know Esther is here, Jack Lee is here, Amy I saw when I came in, there's Amy in the back. Vincent is here, James Louis, Raymond Chan, Barbara Nickel, and some other people who I probably have missed. The work that you've done is a source of enormous pride to me in my life around public service, and so thank you all very much for your contribution. And I can't go by, I know this is the Wenke Greenview facility, but I can't go past the Wenke facility itself without just remarking about a Saturday a few weeks ago that I was there, and I heard about the incredible record in that facility since it has been built and since it's been opened. It's become one of the exemplary Canadian facilities for senior citizens. On every metric by which Alberta Health Services measures success in terms of senior citizen care, it is just an extraordinary facility. And I remember, and having been there at the official opening, I found it remarkable that on an annual basis there are 17,000 volunteer hours that are dedicated by people from the community to the Wenke citizens who live in that facility. It's just an incredible tribute to what we do in this province. So again, thank you. So I'm very pleased to be here today and to share along with Minister Johnson and a number of our caucus colleagues some important news for Alberta seniors. And to be accurate, I'm here to share more important news. Last week, along with Minister Mandel, the Minister of Health, I announced that our government is taking immediate action to ease pressure in crowded hospitals, and so we are fast-tracking the opening of hundreds of new beds in Alberta's continuing care system over the next 12 months. Minister Mandel and I spoke about the need to open these spaces, and we spoke specifically of 464 spaces that would benefit patients from across Alberta who are currently waiting in acute care facility for continuing care facilities to come available. And when we made that announcement, I also indicated at that time that this was a first step that we would be making. And today I'm here, along with Minister Johnson, who was present last week also, to announce the next step. And the next step specifically is that our government will support the building of 1,200 new supportive living spaces across the province. And that's the announcement that we are making today. We will be working with our partners, a number of whom are here. Minister Johnson will introduce them. We'll be working with our partners to increase capacity in senior citizen housing in communities where we know there is a need. The needs assessment work is underway at this time. We know that the need exists in our larger cities because of the population growth and the pressure that we have seen in our hospitals, but it applies also in a number of smaller centers across the province. And this announcement is a province-wide announcement which we're making. And Minister Johnson will provide you with some of the specific deals. I've said before that seniors care is a top priority for me and for our government. I also know that it's a priority for Albertans because I spoke with Albertans across this province the entirety of the summer, and many older people told me about their concerns about seniors' housing and the fact that we have fallen behind in this province. They told me about their fears of not having a place to go when the time comes when they could no longer manage their own affairs, and in particular, their concerns about what they would do when their health gives out at a later point in life and the kind of care and facilities that they would be able to receive. On top of that, I know that people are worried about having to move into a senior's home far outside of their own community, and they told me that they wanted to remain close to their families and to their friends, in many cases to their spouse with whom they would have lived a significant part of their life. And I think I would ask of all Albertans, who amongst us would not want to be protected in that same way? And of course, it's not just older Albertans who are concerned. Most of us here have a parent, have a grandparent, another loved one who is a senior citizen, or another Albertan who needs continuing care facilities. And their care and their comfort and their safety are important for all of us. This, for me, is something that's very personal. My mother she passed away a year ago. She spent the last 10 years of her life in lodges, in lodge in southern Alberta, with a very serious health condition that had her in and out of the hospital. And so when I speak about hospital beds, senior citizen care beds, continuing care beds, I know what I'm speaking about because I lived this for the last 10 years of my life. And so I've seen certainly firsthand how important it is that our older Albertans live in safe and comfortable seniors accommodation, that they remain in housing that is close to their family and to their friends. Aging in place, I think we all know, is vital to helping seniors stay happy and healthy and engaged. And our government recognizes that contributing seniors have made, the contribution that seniors, of course, have made to our province over the course of their lifetimes. I want to assure seniors that we will contribute to a high quality of life through appropriate accommodation. As a government, this will be a priority. Accommodation that meets their health and their housing needs as we move forward. And at the same time, I also recognize that it is certainly a challenge for us as Albertans to ensure that we have housing that keeps pace with our rapidly growing population needs. Like the rest of the population, the number of seniors in Alberta is increasing dramatically. I'm told that we currently have 490,000 seniors in this province. The remarkable statistic that is in less than 20 years, that figure is going to more than double to pretty close to 1 million senior citizens in the province of Alberta. That at that time will be close to 1 out of 5 of every citizens who live in this province. And fingers crossed, that's going to include many of us who are in this room today, certainly myself. Our government is preparing for that future right now, and at the same time we're addressing the immediate need that exists today. We're building these new supported living spaces, continuing care spaces, so that we can provide safe, affordable, quality housing that meets the diverse needs of our senior citizens. There's no, of course, there's no easy one-step solution to addressing the needs of our seniors, just as there is no easy one-step solution to dealing with the alleviation of the pressures in our healthcare system. And so the government will continue to take all the necessary steps to ensure that we make immediate progress now, and so that Albertans can rest assured that we will be prepared for a growing number of Albertans in this province and for a growing number of Albertan seniors in the future of this province. And so thank you all very much for being with us here today. Once again, thank you to Wenki, Dawn, and everyone who is here. Thank you for the realization of a dream. Thank you.
Thank you, Premier. What a great day, and to be able to be here with all of you. And thank you so much to Wenki for hosting us, but also thanks to many of you that have driven a distance to be here, and my MLA colleagues. I know that we've got Minister Wupa, Minister Dorward, and Minister Fawcett, and MLA Lana DeLong, and Linda Johnson, and Ron Casey. And former Minister of Seniors has done a tremendous amount of work on this file in the past and has a lot of respect from all of us. Our whip, George Vanderburg. George. And I want to throw another shout out to the folks from the Alberta Continuing Care Association, Tammy and Dr. Patel, former president and the executive director, that are here with us tonight. They could take the hard questions if there's some hard questions. They know this system better than anyone. And the Alberta Senior Citizens Housing Association executive director, Irene Martin, and Doug. I know they're introduced already, but thanks for making the trip down from the north. As Premier Prentice has said on numerous occasions, the best measure of any society is how they care for their elderly. So when he asked me to serve as Minister of Education, Minister of Seniors, sorry. I did that too many times, I guess. When he asked me to serve as Minister of Seniors, and he reinstated the standalone seniors ministry and what he talked about doing as in terms of a mandate for that ministry, I knew that he was going to make a real and a very positive difference in the lives of our seniors of our province. And that's exactly what we're doing today. When you piggyback this on the announcement from last week and you stay tuned for other announcements and actions that are going to come, you can see that we've got a decisive Premier, and he said, get to work. We're going to ensure that more seniors housing is built in communities that need it. Effective today, we are requesting proposals from community groups, faith-based partners, for capital grants under the Affordable Supportive Living Initiative known as ASLI. I know the Premier has some really great examples of the quality of life being offered by faith-based organizations, and we're in one of them here today. And we will be encouraging the development of more of these kinds of facilities, along with proposals from other partners as well. Supportive living is a vital part of the continuing care spectrum in Alberta. As the Premier mentioned last week, my colleague, the Minister of Health, Mr. Mandel, announced an action to improve access to emergency and acute care. Today, we're pleased to follow up on that good news by requesting proposals from willing community partners to help build long-term capacity in seniors' accommodation, targeting long-term care and the highest levels of supportive living, designated supportive living level 4, and dementia. Now, I'm sure some of our media friends will have some math questions in regards to ASLI and this announcement today. Hopefully I can help out with some of the details. Of the $180 million currently available within the budget for ASLI, approximately $60 million will be dedicated to opening and funding the 300 spaces to accommodate many of the patients in acute care that we want to decant, that we announced with the long-term care beds last week. That action was announced by Minister Mandel in Edmonton with the Premier. The remaining $120 million in ASLI funding will be used to seek proposals to create an additional 1,200 supportive living units in communities that demonstrate need. And because we need these spaces as soon as possible, priority will be given to the applicants who are ready to start development process within the next 6 months. This is a growing population in Alberta, and the decision we make today will help define how we support our seniors for years to come. The Minister of Health and I intend to work together to make sure the needs of seniors are being met, whether it's health care or finding a place to call home. We know seniors want to live independently in their homes for as long as possible, and when they're no longer able to do that, they should have accommodation choices that support their independence and provide the care they need with their families and friends close by. The ASLI grant help provides that kind of accommodation according to the individual needs of the resident. The bottom line is, we know there's a direct relationship between having safe, stable housing and the appropriate supports and health care that go along with them, and a person's overall well-being. That's why our government's committed to building quality accommodation options that meet a variety of needs, so Albertans can remain happy, healthy, and in their communities that they help build for as long as possible. Thank you. God bless.
The Premier and Minister, happy to take questions. We'll start with questions regarding this announcement today, and then if there are questions on other topics, we will handle those afterwards.
So obviously these dollars are being directed to the challenges that we've seen in Alberta recently with and which I describe myself, which I lived through with my own mother, senior citizens in the latter years of their life facing significant care issues where they need continuing care. We've not had facilities able to accommodate them, and so they have been in hospitals really because they have to be in hospitals because there's been no other facilities for them. And so this knits together with what we spoke about in terms of the healthcare challenges in freeing up beds. We need to have these kinds of continuing care beds constructed as quickly as possible to free up space in the hospital system and to ensure that seniors are in a more appropriate location given the circumstances they're in at that point in their lives. Yes, sir.
Appreciate this new announcement, but I want to talk about previous announcements and the delivery of other continuing care beds. The Conservative government had promised 5,000 beds over 5 years. At the end of last fiscal year, as per the cap, they were 1,651 beds short of reaching that, and it needs to be delivered by March 15th, or March 31st of this coming year. AHS has said they plan to add 700 more beds incrementally across the province by March 31st. By my count, that leaves you around over 900 beds short. Do I have my math right? And if so, why should Albertans trust your government to deliver on time and been able to deliver the ones that have been promised previously?
All right, well, I'll leave your math to you, but let me just say,
Sir, if you've got them,
let me just say, I have been the Premier of this province for the past month. I made it very clear that a priority would be the construction of continuing care beds for senior citizens, and that I would proceed on this immediately, and I've done exactly that. We've taken the dollars that exist within the government budget, and we are moving with purpose to build the units. We're searching for partners who are shovel-ready, who are able to get in the ground as quickly as possible to construct these units. Now, you can measure, the accomplishments that I will have as Premier relative to other administrations, that's fine. But I moved on this from the moment I became the Premier, in part because of my own personal experiences that I've lived through, knowing where we are short in this province. And we will construct these units. This proposal call is going out immediately in the next 24 hours, searching for partners to build these units. We have every expectation that there are willing partners who want to get these units built as quickly as we do, and we will.
How many will be in Calgary? 1,500. Do you want me to take that?
Yeah, sure.
Yeah. The long-term care spaces that were announced last week were actually allocated to community, and I believe that 100 of those were in Calgary, if my memory serves. So there's 100 long-term care. The balance of the 1,200 supportive living, you can assume that about a third of that would be in Calgary, but we'll wait and see what the proposals come in, and the shovel-ready projects and the need will be determined as those come in, and we'll see how they flush out.
Yes, sir.
I don't like to bring families in, but you brought your mother into this repeatedly. So when she was in hospital, can you tell us, was she assessed as needing to come to a supportive living facility or a long-term care facility? And if so, can you tell me how facilities like this are going to address the backlog in our hospitals? How do you know that the plan that you have to add supportive living capacity is going to solve the problem?
Well, these will be continuing care beds at the higher echelon of care for seniors who are not just experiencing the fact that they're elderly, but also health problems. In my mother's case, she had a pulmonary disease and she couldn't breathe. And so there was not any facilities in the senior citizen lodge that were able to assist her with that, nor any care in the senior citizens lodge where she could receive that kind of attention. And no, she was assessed as being unable to breathe, and so she would go to the hospital periodically, and there was no other place for her to go. And so she ended up in a circumstance, in a bed, in a hospital, because it was the only place that she could be. The kinds of beds that we are constructing with this announcement and last week's announcement will deal, not just with senior citizens who are able to live independently, but senior citizens who require a higher echelon of care based on the medical conditions that they have, people such as my mother.
We'll take a question from the phone. Operator, please put through the next caller.
Your next question comes from the line of Gillian Slade from Medicine Hat News. Your line is open.
Good afternoon. Just wondering, by not announcing which communities will be the recipients of these, instead making it a decision based on which builder or operator is ready, shovel ready within 6 months, how do we know then that the community where there is the greatest need is going to get the buildings?
With what we're doing here, there's no doubt in my mind that there's great need all over the province, and a lot more need than we have funds to build units for. I have no reservation that we're going to be building units in communities that are of need. We've got a few metrics around this RFP that we haven't really had in the past, but that's in response to what Albertans have asked us for, and one of those is timeliness, and I know that you would probably appreciate that being in Medicine Hat. And with the situation you have there with the project that's taken a little bit longer than was originally hoped.
Mm-hmm. So we still don't know that by the time these are awarded, whether Medicine Hat will get any or not.
Well, we'll have to wait and see what the tenders coming in are like, and as I said, we will be working through the needs that we see, the needs assessment from Alberta Health Services and from the providers that are out in the field, but I expect the proposals are going to have a lot of information on what their waiting list's like and what the demand is in their particular community, and that's going to be valuable information for us to look at.
Thank you, Jillian. We'll take one last question.
Premier, you had a series of announcements in the last week or so, and some of your critics are saying you're trying to buy the by-elections by flooding voters with
Well, we're responding to the obligation that we have to Albertans to govern, Gary, and to deal with the pressing issues that relate to schools in our communities and senior citizen care. These are the issues that I heard about all summer. I promised that if I became Premier that we would move immediately on dealing with these, and we've been doing exactly that. What I hear from Albertans is they want a government that's moving forward, that is decisive, that is using common sense, and that is getting on with the construction of these kinds of facilities. The dollars that we are referring to today are entirely within the budget, the existing budget of the Government of Alberta. There are no new dollars. We're simply moving with dispatch to build the units that need to be built with an RFP that will search out willing partners as quickly as possible so that we can get these units under construction. And I think we all know from what we've seen in the news over the course of the last month, including during the by-election, that we have circumstances in our hospitals in this province where we need to get these continuing care beds built to alleviate some of the pressure. So I'm doing exactly what Albertans have asked us to do and what they asked me to do as I meet them and knock on their doors.
Thank you very much, everyone, for coming today.
Thank you very much. Thank you.